students, we're just going to talk briefly about denture care, okay? So these dentures have just been removed from the patient's oral cavity. The patient is not able to cleanse them, so we're going to do it for them. Now, keep in mind that we always want to encourage the patient to do things themselves. We always want to promote patient independence. So we're going to cleanse these dentures for the patient. So before we get started cleaning the dentures, we want to always make sure that we put a cloth in the basin. If we were actually doing it in the sink, we would apply a towel in the sink to protect the dentures from any breakage, okay? So we always want to assess the dentures before we get started. We have our upper surfaces and we have our biting surfaces and our lower surfaces here, okay? So we always want to make sure that we assess the dentures when we take them out of the patient's mouth for any cracks, any breaks, any ridges that are broken. We should always assess patient dentures, okay? All right, so we know that these areas are our biting surfaces, and these are the areas that we must clean first, okay? So we have our upper and our lower dentures, okay? All right, so first we're gonna get started with cleansing. So usually there's a denture cleaner to clean the dentures, okay? So I'm gonna start with the upper surfaces first. I'm always gonna get some cleaning solution, and I'm always going to brush up here, because usually in this area a lot of food is there, okay? So I'm gonna brush this area here all the way around. I'm gonna rinse it, okay? All right, rinse my toothbrush. I'm gonna brush the biting surfaces, okay? Cleanse all of the biting surfaces. Cleanse the biting surfaces, okay? Up and down, just like you brush your teeth at home. Up and down. We rinse it thoroughly, okay? In the lower dentures, there's always a lot of food in this area here. So you always brush and cleanse and rinse out this area very well, okay? And then you cleanse the biting surfaces first, okay? Cleanse your biting surfaces, okay? And you go from upward to cleanse these areas, okay? We're done with the dentures. We rinse them out. Okay, it's always good to allow the patients to put the dentures in themselves if they can, but we're always to put the upper dentures in first, and then we put in the biting ones after that, okay? We dry these very thoroughly. Remember, if you're going to use the adhesive, make sure that you don't over adhese. Maybe it's just 1 or 2 drops, okay? And securely place them in the patient's mouth. In the lower surfaces, 1, 2, okay? And then apply them in the patient's oral cavity. Okay, thank you.